Hi, and welcome to another episode of DTV. My name is Madison, and I'm an Education Outreach Liaison at Doylestown Health. With me today is Mary Ellen Wisniewski. She is one of our wonderful outpatient physical therapists, so thank you so much for joining me today. Can you tell us a little bit about your education background and, of course, what you do at the hospital?
Hi, Madison. Thank you for having me here. You mentioned I am a physical therapist in the outpatient department, and I am married. I have 20-year-old triplets. I have 2 boys and a girl, and I am originally from New Jersey. I received my undergraduate degree at Seton Hall University. My undergraduate degree is in biology, and I received my graduate degree in physical therapy at Arcadia University. I've worked at Doylestown Hospital for 14 years in the outpatient PT department. And in December of 2020, we moved our department from the main hospital building into our brand new ambulatory center. And the ambulatory center is the Clark Outpatient Rehabilitation Center. And in my role as a physical therapist, we evaluate patients to determine where they may have functional restrictions in their mobility, deficits in strength, or range of motion. And we design a treatment plan to address those deficits to help decrease pain and then help improve their overall mobility.
Well, thank you so much. So I can only imagine that you work with a lot of people that are suffering with arthritis, and there are probably a lot of people that could benefit from your services. So I would love to talk about living with arthritis and going to physical therapy. But first, can you explain a little bit about the different types of arthritis and what it is?
Sure. So according to the CDC, arthritis, it's a broad term describing conditions that impact the joints or the tissues around the joints. The Arthritis Foundation and the CDC list several common symptoms. They include swelling, pain, stiffness, decreased range of motion. The intensity and duration of those symptoms can vary. And there's actually several different types of arthritis. Degenerative arthritis, which is wear and tear, arthritic, which is osteoarthritis. Most people are familiar with that term. Inflammatory arthritis, which is rheumatoid arthritis. Infectious arthritis is where there's a bacteria or a virus or a fungus that gets into the joint, and that causes inflammation, which causes damage to the joint. Metabolic arthritis caused by something such as gout, okay? Statistics, the numbers are pretty high. There's more than 100 types of arthritis and arthritic-related conditions, and it is a leading cause of disability in America. Over 60 million adults and 300,000 children have been diagnosed with arthritis. It does impact women greater than men, and there is an increased risk for arthritis as we get older. CDC has a graph that lists how arthritis diagnoses will increase as our population ages and grows. In fact, the projected cases by the year 2040 are 15 million more than in 2020. So short window of time with a large number of patients being potentially diagnosed. One of the most common types of arthritis, and one most people are familiar with, is osteoarthritis. So osteoarthritis affects 1 in 10 adults. It is described by the CDC as a wearing away of the cartilage, which is the joint cushioning. If that joint cushioning wears away, then you can have bone on bone, and that then causes joint damage, pain, swelling, stiffness. And it's one of the most common things, diagnoses of arthritis that we see in the clinic. Rheumatoid arthritis, on the other hand, is an inflammatory type of arthritis. That is an immune system response that's abnormal. So our immune system attacks the joints, and when that happens, that can cause pain, inflammation, and joint damage or joint erosion. Because it's an immune system response, Can affect many joints at the same time, often affects both sides of the body, so both hands, both knees, both ankles, multiple fingers on our hands.
So you would say that osteoarthritis and rheumatoid arthritis are one of the most common types out of all of the arthritises that you would see?
Correct, yes.
Okay, so for someone living with arthritis, what is the benefit to physical therapy?
So that's really an excellent question. So first of all, if someone is having pain in their joints or just pain in general, you want to know what the cause of that is. So first of all, follow up with your physician so you get the appropriate diagnosis as to the root cause of the pain. For people that have been diagnosed with arthritis, one of the most important strategies is physical activity, increasing your physical activity. Being active can decrease your pain. It can improve your function. It can potentially delay disability. For physical therapists, when we do our assessment, we would make recommendations on joint-friendly activities and exercise that are catered to the deficits of the patient. The treatment plan works on those areas that we would identify during the assessment and trying to improve the overall mobility of the patient.
So when should someone start to seek treatment for physical or for arthritis?
So if someone has had a change in their mobility due to pain or a loss of range of motion, or they've noticed that their strength and their mobility is not what it was, they should follow up with their physician, and they can discuss whether they feel physical therapy would be an appropriate option for them. Physician would write a prescription for therapy, and then the therapist would evaluate the patient. Education is super important early on, and appropriate activity. Again, the idea of trying to prevent or minimize the likelihood of further damage as much as is possible.
So is there ever like too early to go to physical therapy for arthritis?
Not necessarily. Certainly if someone is having significant pain, if they have rheumatoid arthritis, for example, symptoms can wax and wane. Someone can be in a significant arthritic flare if it's rheumatoid arthritis. So in that instance, discussing with the physician, managing that pain to allow someone to tolerate an increased activity program would be appropriate, and then working on exercise and activity. So certainly, again, discussing with the physician where the person is at that point. If when someone is referred to therapy, we are finding that their pain levels need to be, addressed, or they're not tolerating exercise, we do adjust the program accordingly.
So are there different types of therapy for the different types of arthritis?
So the exercises and the treatment plan are modified according to the deficits that we identify at the initial evaluation. So it's not necessarily per the type of arthritis, but rather the deficits that we identify during the assessment, or whatever deficits there may be. However, we do keep that diagnosis in mind because, like as I mentioned, rheumatoid arthritis affects multiple joints. So we could maybe be addressing knee pain in someone who has rheumatoid arthritis, but they could have pain in their hands where they can't grip the stretching strap to stretch their hamstrings. So we would make modifications to do the stretch that it doesn't impact the other areas that they may be having pain in. With osteoarthritis, same thing. People will often have it in other areas. They might have arthritis in their knee. They may have osteoarthritis in their shoulder. So again, we look at adjusting the exercises to the particular individual's issues.
So what are some of the treatment options with physical therapy?
So as I mentioned, we look at where an individual may have some deficits in their mobility or their strength, and we may add things like strengthening, flexibility exercises, manual therapy or hands-on therapy to help facilitate stretches, balance training, education in posture, education in walking or using an assistive device if the person could benefit from that, and then also giving people a home exercise program to work on in between the therapy sessions. One of the most important things is that people work on their exercises in between therapy sessions, because that's the tool that they have at their disposal, and the thing that is going to continue them for when they conclude their therapy program.
So I know every person is different with the different types of arthritis, but what would a typical physical therapy session look like?
So the first session is the initial evaluation. So that's where we meet with the patient, we review the medical history of the patient, determine what their goals are for therapy. Very often we'll hear the goal of getting back to gardening, or I want to be able to garden, or I want to be able to walk or lift my grandkids and not have pain. So identify that. And then we do our assessment. Where are their range of motion deficits? Where are their strength deficits? How is someone moving? What is their posture? What is their pain level? And then the treatment plan is developed based off of that. Treatment frequency and duration, we make a recommendation for the patient. And then follow-up visits, usually we'll start out with some type of a warm-up. So usually an active warm-up, so the bike or walking or the new step. If someone's having more pain, we might start out with some heat to loosen up the joint. And then we begin the exercise and stretching program or working on balance, walking, again, depending upon what the person needs. We educate the patient throughout the process. So why are we doing the exercise? What is the expected response for the exercise? Where should they be feeling the exercise when they're doing it? And equally important, the normal response to the exercise. It's not a no pain, no gain situation. Because we're looking to protect the joints, we're looking to build strength and flexibility around the joints. We don't want to work through pain if pain is persistent. So we educate people to monitor their symptoms, both in the clinic and at home, and education on posture and how we move our bodies. Often certain positions can unintentionally aggravate our symptoms. So we will educate on the importance of good posture during their daily activities and during their exercise program.
So you briefly mentioned assistive devices. Do you recommend those? Do you work with those at PT? What does that look like?
So we can and we do make recommendations if we identify that someone is having problems. So for example, if someone has been dealing with arthritis for a long period of time and they come into the clinic and they're really limping, we may recommend that they use a cane. Or if it's both knees, we may recommend a walker. And then we fit the device to the patient, teach them how to use it, upstairs, uneven terrain, level terrain, what's the proper usage of the assistive device if the person needs it. And we discuss that with the patient, and we recommend that and let the physician know as well.
But what about like wrist braces and knee braces, stuff like that?
So we have certified hand therapists in our clinic, and they will very commonly see, rheumatoid arthritis in the hands, and they can make recommendations as far as bracing for the hands. So oftentimes for the hands, they're custom braces. Sometimes they're not. They have over-the-counter braces that they can recommend. Also for the hands, adaptive equipment such as large barrel utensils, large handle utensils, things that make day-to-day activities a little bit easier, but a little kinder to the joints. Braces, sometimes our patients will come in and they have a knee brace or something that they've tried on their own. Occasionally we may recommend an offloading brace to the knee, but often that will have come from the physician. The patients will, if that's something that somebody needs, oftentimes they will have already had that discussion with their orthopedic physician.
Okay. So how long would you see a patient for arthritis?
So again, depending upon what the person's deficits may be. So if someone is newly diagnosed and if they don't have a lot of restrictions, perhaps they've just been diagnosed, they have a little pain, a little stiffness, but not a lot of functional mobility restrictions, it would probably be a very short course of therapy on home program instruction and education versus someone perhaps who's had arthritis for a longer period of time. We might see that person for a longer period of time. So we might see them for 4 weeks, 8 weeks, again, really customized according to the patient. But we do the initial assessment, we do a formal reassessment after about a month, but we do assess the patient each time they come in. So if they've had a change, or for example, if it's rheumatoid arthritis, symptoms can wax and wane. People can have flare-ups because it's an immune system response. So if they're having a flare, then we would modify the program and adjust things accordingly.
So when someone's diagnosed with arthritis, you might see them multiple times in a year or multiple times throughout their diagnosis, right?
That is correct,
Okay.
yes. So if someone's had a change in their mobility, or for example, they have had a prior diagnosis of knee arthritis, and then they had an injury to their shoulder, and then somewhere down the line, their shoulder perhaps started to bother them. We may see the individual for their knee, and then for a different body part.
All right. So what are some tips and tricks that you can give to help people manage their arthritis at home and every day?
So the acronym SMART, I think, is very helpful. This is outlined on the CDC website. S is for start low, start slow. Kind of common sense approach, but again, it's not a no pain, no gain situation when you're starting your activity. You're trying to improve activity, which is super important, but you have to also protect the joints so you don't cause further damage. You want to modify your activities. You want to be active, but you have to adjust your exercises if you're noticing an increase in pain. And if that pain is persistent, you're having sharp pain or any concerns, go get that checked with your physician. Activities should be joint friendly. So we've mentioned that a couple of times. So what are some joint friendly activities? Yoga, Tai Chi, walking is great, biking, and again, modify if there's any pain. R is for recognize what's appropriate for your particular body and where is it safe to exercise. So what I mean by that is if you want to start a walking program, for example, it's going to be a little kinder to the joints to start walking on level terrain through the park versus taking the trail up the hill, uneven gravel terrain, and taking your time and seeing how your body responds. So again, you're not getting a pain spike and a flare, and then you have to back up your activity. And lastly, T, talk with your healthcare professionals. So again, before embarking on any kind of an exercise program, you want to know what is going on diagnosis-wise, so touch base with your physician first. Regarding osteoarthritis, again, that is the most common one, most commonly diagnosed is osteoarthritis. The CDC has several what they call frontline interventions or categories of information. Firstly, self-management and education. Education is key, and there is a wealth of information online where people can learn about osteoarthritis, rheumatoid arthritis, learn about questions that they can discuss with their physician. So educate yourself. And I have some resources I can share at the end of our discussion. Physical activity, again, super important. What is appropriate for that individual? The therapist would make recommendations, but every little bit of increasing your activity helps improve strength, flexibility, mobility, even simple things like parking a little bit farther from the supermarket door with the car so you have a little bit farther to walk. Or if you're doing housework, put some good music on, move around a little bit, get up and move. Sometimes when we're in pain, the last thing we feel like doing is moving. But appropriate movement, joint-friendly movement, starting low and slow, is where you begin so you can start to help loosen things up and improve your strength and flexibility. Preventing injury. There are studies that have shown a 3 to 6 time increased risk of developing knee arthritis if someone has had a prior knee injury. So when you're exercising, when you're playing sports, looking at stretching and strengthening and balance training, looking at the big picture, not just stretching, not just lifting weights, but looking at multiple, kind of the big picture so that you're trying to, as best as you can, try to prevent injury, okay, or falls or trauma as best as you can. And lastly, managing your weight. For every pound of weight lost, there's a 4-pound reduction on stress or load to the knee. So that's pretty significant. So even just losing a few pounds can reduce the stress on an arthritic knee significantly. So before beginning a weight loss program, obviously, again, check with your physician to see what's appropriate for you. An individual may have other medical issues that are going on that they really need to closely monitor. What's the best approach for them if they want to lose weight? If someone is diabetic, someone has heart disease, someone has other medical issues, their exercise plan and program or weight loss plan or program could be very different from someone else who doesn't have those other medical issues to think about. So again, touching base with your healthcare provider is key. Additional resources, things to keep in mind when you're trying to educate yourself so you can discuss with your healthcare provider, the CDC, abundant information, the Arthritis Foundation, the American Physical Therapy Association website, again, a lot of information there. The American College of Rheumatology for individuals diagnosed with rheumatoid arthritis or other inflammatory immune system arthritic problems. The Arthritis Foundation I mentioned, and the Osteoarthritis Action Alliance, which is on the UNC, University of North Carolina website. Again, abundant information on osteoarthritis.
So it kind of seems like one of the big takeaways here is from your diagnosis, you should really get some research in, understand what's going on to help manage your pain and kind of understand, what your life is going to look like with arthritis.
Correct. Education is definitely super important because then that gives you the tools to discuss it with your healthcare provider. It gives you the understanding of how am I going to manage my activity so I'm protecting the joints, so I can do what I want to do, but I'm trying to, again, to manage my pain. How can I manage my pain? How can I improve my strength and flexibility and my general mobility in a safe way to try to just improve and be more active?
So if someone is interested in seeing you or your team for arthritic pain or really any physical therapy needs, how could they contact you?
So we are in the Clark Outpatient Rehabilitation Center, which is in the ambulatory center, the new building that I had mentioned earlier, on the main hospital campus. Our building is towards the front of the campus, right in front of the parking garage at 593 West State Street. And our information is on the slide there, but we have morning hours, we have evening hours, and we have a great staff of therapists who are available to help.
All right, well, thank you so much, Mary Ellen, for joining me today.
Thanks for having me. I appreciate it.